Hi there, I'm Leah and welcome to the House of Hormones podcast.
So hello and welcome along to the House of Hormones podcast. Today we are lucky enough to be joined with the lovely Dr. Ravina. Hello, Dr. Ravina.
Hi Leah, hi team, thank you for having me.
We're so happy to have you here today. So for anybody that doesn't know about you and what you do, tell us a little bit about the work that you do and why it's so important.
Thank you first of all just for having me. It's my favourite topic to talk about. I'm Dr. Ravina, I'm an NHS GP and I'm specialised in women's health. I'm founder of Zonas Fertility, which is a fertility platform to empower couples to help them get pregnant. And I'm also super passionate about educating on all things women's health on social media and media in general.
What's your personal goal? So I know that, it's really close to your heart and you are so passionate. What is your goal?
Yeah, it's a good question, actually. I'd say there's probably two things I can think of that I feel super passionate about. The first is just empowering women with knowledge about their bodies, whether that's online or whether that's offline in my clinics. I find on a day-to-day basis, the baseline level of knowledge for women is so low, and it's because we're not taught at school. We're not taught in any other way other than online, on TikTok, on Google, asking friends, but we don't know what's real and what's myth. And that is what I find very difficult when dealing with women who are coming to see me and they don't know what's wrong with their bodies. They're really scared and sometimes really embarrassed. I had a patient a couple of weeks ago. She was a 16-year-old and she didn't know about her anatomy down below. And she said, look, I'm having sex for the first time and I don't know how it's meant to feel. I don't know what hole does what.
Yeah.
And it can be super daunting and embarrassing to come to a doctor and ask this. But for me, I absolutely love educating. And I think because we're not taught it, it's really important you ask the right people. And we discussed where her vulva was and how to feel pleasure and where you might feel pleasure and where it might hurt. And if it does hurt, what to do about it. And it just really showed me that we need to be educating women. So that's one of my key things. And then the second thing I was going to say is just sort of bridging the gap between my life as a doctor in the clinic with all my medical knowledge, and then bridging that with social media. There's so much misinformation on social media. There's so many myths and try this product, it will help with this and it'll help with this discharge or heavy periods. And women are just trying anything because they are going through a really difficult time. And I completely get it. The first place you're going to look is on Google or TikTok. And so I really think it's important to just bridge that gap and teach people what's truth and what's false. And so often I see women so scared. They said, I Googled this, doc, and I think I've got cancer, or I think I've got endometriosis. And I'm like, you know what? I love the fact you've researched because it's important to research. We need to make sure we're getting the facts from the right places because there's no point being riddled with fear and terror. We just need to get the right information to the right people so they feel empowered.
I actually remember saying that sentence. I remember saying that sentence, one, to my husband a lot, and two, also to my doctor, said, I know I'm not meant to Google it, but...
Everyone does. It's okay.
Well, why do you think so? Let's take that back a little bit. It's so interesting that you're saying a 16-year-old came in and asked you that, and thank you for sharing that. And obviously, we're not disclosing anybody's information, so it's fine. But I remember my mum telling me when she went to have her first baby, and bear in mind I'm 40, so my oldest brother must be 45, 46. So 46 years ago, my mum, when she was having her first baby, she wasn't sure how it was going to come out. That's how little education they had. She genuinely wasn't sure. And then she wasn't sure. She'd had stitches during childbirth, and she said afterwards, she asked the nurse, how am I going to go to the toilet? That's how little, she wasn't sure how she was going to have a wee. That's how little people knew about their actual anatomy and what goes on where. And it's so lovely to hear that you were given that education. But the problem that we have at the moment, obviously, is the appointment slots that you have. You need to be treating people and seeing people. You haven't really, as a doctor, got time to be educating. What should we be looking at? Which part of the system is letting us down? Is it in schools? Like, is the education system not good enough?
It is a good point, and there isn't a sort of a bandage that's just going to fix all the problems. We want women to feel empowered, and we want them to have the education they need from a really young age. It's great us knowing this information when we're adults, but actually it's when we're teens, pre-teens, when you're really worried about what your first period's going to be like, what your first sexual encounter is going to be like. And it's really embarrassing to even ask this, to even, your best friend or your mum. It's not everyone has a sister or someone older who they can turn to for advice. And many schools do have sex education at school, but some vital parts are perhaps missing, or perhaps there isn't enough emphasis on this being taught.
Yeah.
Because of course there's so much for us to know, but it's not just women that need to know, it's men. Men need to know about periods, they need to know about sex, they need to know about what happens to a woman's body, because when they do meet a girl, or when they do have their mum or their sister goes through something, they need to understand. And that's how we need to bring in men and educate everyone. And I think it starts from a young age. I think it starts from, teenagers.
I'm so pleased you said this. I mean, that's one of the big things we talk about at the House of Hormones, and we're actually doing a campaign at the moment of how to include men, and also we want to hear their opinions. Like, I kind of love their questions. They have really great questions and they're valid, and why shouldn't they be allowed into the conversation? So we're working on that a lot. I'm really pleased you pointed that out. I have a 7-year-old daughter, so let's talk real life. In fact, she's turning 8 years old, and of course, it's very prevalent at the moment in my house. I keep thinking of, right, when am I going to start having these conversations with her? I got my period when I was 9, maybe just virgin on 10, so quite early.
Yeah.
And of course, naturally, it's meant to be that you kind of follow, your mother. So knowing that what do you think is the right age?
Honestly, there is no right age. I think it depends on how you want to go about that conversation, how mature you think your child is to take that information. Will it scare them? Will they feel ready to have that conversation, to have their friends started their period? It's so situational. Some children don't, they don't want to know, or they're quite squeamish, or it might upset them. And of course, seeing blood for the first time is really scary. But if perhaps in your case you have a younger age of menarche, so first age of periods, then you might want to start having the conversation. And it's just about going about it in a really calm and casual way, saying, as women, this is something that will happen one day, and it's a really exciting time for you, and sort of making it a positive thing rather than something that you should be feared about, or something that's really negative. Because I think if you know something's about to come and you expect it to come, it's not so surprising when it happens. And I find some parents who've never spoken to their children about it, and then they have their period at sort of 10, they come into the clinic and they're really distressed. They said, we weren't expecting a period in our child to come so young. We weren't expecting to have this conversation, and now it's all happened, and the child's upset, and we don't know how to tell the school, and she's bleeding a lot. And when you're not expecting something, you haven't prepared for it, it's always just a little bit more scary.
Yeah. And in terms of from when I had my first period, I remember hiding sanitary towels up my sleeve and like going to the toilet. People are still doing that, and we're in 2025. People in the workplace, women, they're taking their handbags to the toilet just because they wanted to bring a sanitary product. Why do you think it is still so taboo?
Oh gosh, it's such a difficult topic. I think there's a lot to do with the workplace. So in my GP practice, we actually have a dispenser. In the main bathroom, we have 2 or 3 bathrooms. In all of the bathrooms, we have a dispenser for tampons, pads, panty liners, and that's in an NHS trust. So you don't get, this isn't commissioned. But I think in big corporates, there needs to be some level of education from like employee benefits. We need to be encouraging women and men to be talking about their health, their fertility, menstrual care, and it needs to be provision from the top down. I think that women are going to start feeling comfortable in their workplace about it. And I actually did a talk a couple of weeks ago at in a corporate about menopause, and there were a lot of men in the room, and I think it was really important to get men in the room, because if women feel comfortable talking about this in the presence of men, then on an everyday basis, it just makes life so much easier.
I agree. And like I said, it's a huge thing that we're working on to try and get men more involved. I think they think we don't want them in the conversation. So I think it's about changing that and allowing them and allowing their questions to be valid and not to patronize them and allow them to feel comfortable in asking. You know, like the thing that I find really interesting is most women don't know the answers either. So we are as inquisitive. And so I think if men knew that, if men knew how little that we know, it might encourage them to, you know. We did a couple of weeks where we kept asking women, can you name the 4 stages of your cycle? Luteal would come up a few times, but I don't think I heard the word follicular once. Women genuinely don't know, you know, the different stages of their cycle and what's actually going on with their bodies. You touched a little bit on fertility there, and I know this is a specialist topic for you. So let's dig a little bit more into this. When we hear the term fertility, when we start talking about fertility, why does everyone kind of turn to the woman?
Oh my goodness. Wow. Yeah. Why is it always a female issue? I mean, it always seems to be the case, doesn't it? And it's a real shame if I'm going to be completely honest. And I think it's really important that we don't ever place blame or contributing factors just to one party, whether that be male or female, because it's 2 people in a relationship and it's 2 people involved, and we need to bring both people in so that we can tackle this together. So I think with fertility, I think there's a few reasons why perhaps women are thought to be more in charge. One is natural biological processes that happen in a female body perhaps affects a woman more than a man. Second is perhaps sort of social pressures. And third, I'd say in a lot of cultures, there's more of a expectation that the woman should be in charge of being the child bearer and be in charge of the family. So perhaps in those set cultures, it's more of an issue for the woman as opposed to the man. And what I find is with women, there is a biological clock, and whether we like it or not, there is some things that affect women more than men. And we know that it's slightly more time sensitive. So less than 35 is perhaps the sort of the ideal age to try and start to conceive.
Mm-hmm.
After 35, it gets a little bit more difficult, not impossible. I've seen lots of women get pregnant after 35. It's absolutely possible. But they're just sometimes slightly harder. It's a slightly longer process, and pregnancy can be slightly more difficult. But of course, there's lots of things like women's careers and ambitions, and they want to go traveling, or they haven't found the right person yet, and you can't rush those things before having a child. It's everyone's on their own personal journey. So I think first of all, it's more time sensitive for women. Second of all, men can make sperm and produce sperm throughout their entire life, and we've seen this with so many like famous men. I was just reading about men that had children in their 60s and 70s.
Yeah.
So there's like actors like Robert De Niro or Hugh Grant, Elton John. These men have all had children sort of 60s and 70s, which is of course not possible for a woman to do. And yes, it's fine if they want to have children at a later age, but we need to remember sperm quality. Sperm quality is really important. It's not just being able to produce the sperm. It needs high enough quality so you can produce a viable pregnancy. So I'd say, the time-sensitive nature.
Sorry to interject, but does sperm quality go down the older you get?
Definitely, yeah. So just as any part of our body naturally ages, like our skin will get weaker, we have less collagen, our bones are weaker, we don't digest food as well. Just in the same way, our reproductive organs don't produce good eggs or good sperm as we get older. So those are important things to consider.
And what age does that start happening in men?
There's not like a set age because there's so many contributing factors that affect the quality of sperm. Age, lifestyle, things that you do on a day-to-day basis. Are you exercising? But we know that as you get older, sperm will just not produce as well. The testicles, the testes is where sperm is produced. It's like small little factories, and those factories age. So you can produce it, but it may not be as good.
obviously you can dig down a lot deeper, but is there any simple ways to know, or obvious signs that your fertility might be an issue?
I'll be honest, you can't really tell until you start trying.
Yeah.
And I've spoken to a few couples who are trying to get pregnant, and one of the partners, either the man or the female, are working abroad, and they come to me and say, we're trying to conceive, we've been trying for many months, but we only have sex twice a month because we're traveling. And then I'm saying, well, you need to have sex more than that if you want to get pregnant. So I think you actually do need to try proper. So when I say try, we usually recommend every 2 to 3 days in a month. And some people just say, oh, well, I track my periods, I know when I ovulate, so I only have sex during my fertile window. And that's fine if you want to do that, but you're not optimizing your chances, because we know month on month your ovulation date might change even by 1 day or 2 days. So you're not really optimizing your chance of getting pregnant. You really should be trying throughout the month, because we don't know exactly when it's going to be that golden moment when the egg's going to meet the sperm and you're going to get pregnant.
So your top tip would be have sex every 3 days?
Every 2 to 3 days, yes.
Every 2 to 3 days. No pressure, guys. No pressure.
Yeah, it's a commitment. You need to make sure you have the time for it, and that you're not too tired. And of course, with everyday pressures and work and going to coming back from work late, or having other children, it can be really difficult to fit that in.
Got to give up your full-time job just to. Speaking of that, there's a lot of controversy at the moment. I'm sure you've seen it the last few weeks about the cycle tracking apps and whether they're increasing, whether they're actually helping with fertility or whether they're not. And there's also calls that they're increasing abortion and things like that. What's your take on that?
We know that women are naturally just feeling a bit more inclined to take more control of their birth control. And I absolutely love that for women. I want them to feel empowered. And they're using things like natural cycles to track their periods. That's great. And I want them to know that they have control. They can log things, they can log their temperature. But we know that it isn't 100% accurate. And month on month, things change. Life changes, things happen. You may exercise more, you may exercise less, you might get more stressed one month. You might be traveling, and we know traveling affects your hormones. So every month, something's going to change. And that means your body isn't always working like clockwork. So we can't say day 14, every month you are going to ovulate. It might be day 13, it might be day 15. And therefore, we can't say for sure that you've got a safe day. No day is particularly safe. And yeah, unfortunately, I've seen it many times where women have said, I'm not ready for this child. I do not want a child, but I've unfortunately got pregnant and I want to know my options.
Yeah.
And we support them. We support them in the best way we possibly can, mentally, psychologically, and actually going through with a termination of pregnancy. But it's becoming so much more common just from my own personal practice and also with my colleagues. We know it's not the most reliable form of birth control.
Mm-hmm.
There are other options. So it's about weighing up the pros and cons. And if women are happy to have that small chance of actually you can get pregnant and it wouldn't be the end of the world if you did get pregnant, fair enough. But it's the heartache of women coming to us and being so psychologically damaged with the fact they've got a baby they never wanted and now have to go through a whole procedure of getting rid of a baby they never wanted. And that's not an easy process.
No.
It's a really difficult process to go through that.
So I think, track your cycle, sure, but definitely don't use it as a means of contraception, right?
I wouldn't advocate it right now. I don't think there's enough evidence to support that it's the most accurate and the most successful type of birth control. We know there's ones that are way superior that will protect women from an unwanted pregnancy.
One thing, just while we're on this topic, I'd like to dig into a little bit more. So obviously, we talk a lot about cycles, and you might eat different food during your cycle, or you might do different exercise during your cycle, or, sometimes you might have a higher libido at different times of your cycle. A friend of mine had very specifically said, and I was really interested in this. So naturally, you would think when you're ovulating, that's when your libido would naturally increase. So you would be more, interested in having sex or something like that. She actually had the opposite. So actually, she had a huge increase in her libido straight after her period. So maybe day 5, day 6, day 7 of her cycle. And then actually, when she ovulated, she would then get cramps and pain, and then she would go in, and then so that would not be the time where her libido would increase. And she completely swears by this, and said that is when she got pregnant. She got pregnant straight after her period. Is that actually biologically possible? Talk us through that.
Yeah, this is a good one, because one of the most common questions I get on TikTok and Instagram is, can I get pregnant if I'm on my period? And it's that time when you're not sure if it's possible to ovulate, and so you think, oh, perhaps it's safe. But I know I've got friends that have got pregnant whilst having sex on their period, and it's not impossible. So yes, libido can.
So hang on, Dr. Ravina, sorry, before you go on. So Dr. Ravina is saying you can get pregnant whilst on your period.
100%. Absolutely. It's not impossible. And obviously for some women, they have really regular periods and they'll be like, no, absolutely not. My ovulation's on day 16 and it's not possible. So for some women, it's less likely, but you can't rule it out. It's not impossible.
My friend's going to absolutely love you. She's going to love watching this, because for years, we've been sat round in a girls' chat and people are saying, no, this is the window of when you can get pregnant. And, you're so now we know, we've heard it from yourself. What's 3 things people don't really know about fertility?
I'd say the first one is definitely that you can get pregnant on your period. So I think that has to be number 1. And it's one that a lot of people ask me about. They're like, oh, actually, I should be safe because, I've missed my period, but I had sex during my last period, so it's fine. I'm like, do a pregnancy test just to check. The second thing I would say is, so when couples are trying to get pregnant, they try and do everything they can to optimize their lifestyle. They go to the gym, they eat well, they stop smoking, they try and lose weight. But sometimes if you get too obsessed with this, so if you become too fit or go to the gym every single day, it can actually cause harm to your fertility. So if you're causing too much of a stress reaction on your body, you have levels of cortisol, and that can then cause a disruption with your hormonal balance, and then it can throw off your reproductive organs to produce the hormones you need for ovulation. So we always say everything in moderation in a life that suits you. If you're already going through a really stressful period and then you're putting on, extra pressure on yourself to eat the best food and, sleep loads of hours, and you're trying to do too much at the same time, it can have an adverse effect on your fertility. And I think a lot of people don't know that. They think, let's just do everything we possibly can all at the same time, but they're actually causing too much harm.
Yeah. So by increasing your cortisol levels, actually, it's decreasing your likelihood of conceiving.
Yeah. Exactly.
Wow. And what's so 3 tips to improve fertility?
Okay. So the first I'd say is have sex regularly.
Every 2 to 3 days.
Days throughout the month, and not just in your fertile window. And also, even if you have irregular ovulation dates, still have sex regularly, because even if you don't have a period for a few weeks, or perhaps it's a bit late, or perhaps you normally have irregular periods, you are still ovulating, so you can still get pregnant. So some women...
Well, actually, because, so thinking about those people who maybe do have regular cycles and then are literally, going for it within this section. And actually what you've just said is it could be, if they were just having sex every 2 to 3 days, it could be that they might conceive straight after their period, or the body might be working in a different way, and there's no way to know that.
Yeah, and there's one danger time that I see particularly with some of my patients, and that's I do a 6 to 8 week baby mummy check after they've given birth, and some women, they're like, I absolutely don't want any birth control, I'm not ready to have sex, and that's, I say that's absolutely fine, come back to me when you're ready. But after postnatally, some women breastfeed and some women's periods take a while to come back, and then they think they're safe. and they think I can't get pregnant, and it's just they have sex one off and they get pregnant within the year. And it's because it's a really dangerous time, because you've got irregular periods, some people are breastfeeding, so your hormones are all over, and you're just a bit more risky. You just think, oh, I've just had a baby, how can I get pregnant again? And so it's that 1 year after that I find some women get pregnant without realizing.
I've heard of this before, and is it true that, so for all those reasons, but is there actually a heightened chance, like, are your hormones, you know, the way I was told this was that you're extra fertile during that, you know, after you've had a baby?
It depends on what you're doing with breastfeeding. So we know that for the first 6 months, if you're totally breastfeeding and you haven't had a period in the first 6 months, then you don't need any additional birth control. That acts as birth control. But if you aren't, and you're doing mixed feeds and, you know, a little bit of formula, a little bit of breast milk, but are still sexually active, then you can definitely get pregnant. And I think it's perhaps not that you're ultra fertile, it's just that your hormones are regulating again, because you've had high progesterone levels during pregnancy and that's sort of coming down, and then you're regulating your periods. So it's more that it's just a little bit more unpredictable, when perhaps before pregnancy you would have had many years of tracking your periods, you know how your body works, and now, you know, you've had a baby and everything's just needs to reset itself again.
And digging a little bit more into sex, because I know you talk a lot about that. People, I mean, you must get asked this all the time, but are there specific positions, or are there things to do during sex? I mean, dare I go down the route of, you know, certain people have said, if you have sex in this position, you can have a boy or you can have a girl. I mean, how ridiculous are these myths and these claims? Give us some facts.
It's a really good question, and it's a really good question. Yeah. In terms of clinical studies, there aren't many clinical studies, as you can imagine, testing the different sex positions that increase the chance of pregnancy. So there's no sort of evidence to back up any particular sex position. We can talk about theories and theoretical sex positions that may help, but as I said, can't advocate because there's no evidence. But I would say, if you think about sperm and how far it has to reach, how far it has to travel before it reaches the egg, that sort of shortening that time and that journey for sperm can help to increase your chances. So deep penetration positions could help.
Okay.
Because if you think about if there's deep penetration, the sperm's closer to the cervix, and then it can travel straight to the egg, as opposed to something that means it's a little bit further for the sperm to travel.
And then I'm sure you have been asked, sorry, just while we're on that little bit.
Yeah.
Have you heard then of women who would then, you know, sit up against a wall and put their legs up and things like but people do this. Is this a load of rubbish, or is it true? Tell us. Everyone wants to know.
There's absolutely no evidence to say that it helps. Absolutely none.
But gravity, right? Like, it kind of makes sense.
I get the theories, and I can see how women would and men would think perhaps, yeah, it could help. Gravity doesn't play that much of a part, because the sperm travels so quickly that by the time you even think about putting your legs up after having sex, the sperm's already whizzed up. The ejaculate has already swum so far that gravity will have such a minimal effect.
Okay.
But, you know, if couples are finding it difficult to get pregnant, it's not going to do any harm. I can't say it's going to help, but it won't do any harm. So you can try it.
Yeah.
The point is, if you perhaps stay in the same place for a few minutes and don't move, then, you know, the sperm's not going to come all the way out. So perhaps it can help, and you're not going to do any harm. But obviously, still no research.
It's not one of your top tips, but it's like a why not?
Why not?
Give it a whirl.
Why not? But on the topic of sex positions and things that can help you get pregnant, I think it's really important to also stress that it's important for females to orgasm. And the reason why I think that's important, because obviously we know it's the man that does have to orgasm in order to get pregnant. But the reason why it's important for women is, one, sexual pleasure. You do need to enjoy it. But second, your womb actually goes through a process when you orgasm. So you have an increased level of blood flow that comes to the womb that allows lots of juicy nutrients to allow that sperm to come in. And you get something called motility. So you get sort of hair within your womb that wafts the sperm and allows contraction for the sperm to move closer to the egg. And that only happens during orgasms. So it's really important because it actually has a process that allows the sperm to work better and allows it to be accepted into the womb.
So you've got a doctor's appointment coming up and you're just trying to figure out what the hell is going on with your body. You need our free symptom tracker. It's like the receipts folder for your hormones. You can track the bloat, the mood swings, the brain fog, the mystery acne, and then roll it all into your next appointment like a hormonal pro. No more being brushed off or told it's all in your head. You've got the data. Download it for free today from our website and start advocating for yourself. www.thehouseofhormones.com and head to our free download section.
Can I just say, I'm 40 years old and I have 2 children. My children are 8 years old and 5, and I have never, ever heard this. Never.
I'm so glad. I'm so glad you know now. It's never too late.
I won't be having any more. But this conversation is purely for other people. I'm trying to ask the questions that I think other people would want to know. And I mean, it's really interesting because it goes back to the first question that I asked you about fertility. Why do people think, when you think of fertility, you think of the woman and it's more of the woman's, job. And this kind of brings it back again. It's like, wow, men need to know this. Men really need to know this. And actually it opens up a whole new conversation because, as we know, the statistics of women who actually orgasm during sex are very low, and the conversation surrounding that is almost like it's not there. It's invisible. People don't have that conversation. And obviously my background is in psychology, and I've read loads and loads of studies on this. I find it so super interesting. But as to reasons why people don't discuss this, realistically, there needs to be more of a conversation around this infertility. Because if I'm 40 years old with 2 children and I've never heard that before, then surely most people don't know that it will hugely increase your chances if you orgasm, if the woman orgasms as well.
Yeah, it's an important factor.
Wow, thank you for that. So I know we've touched on this briefly, throughout, but how do we include men into the conversation? And we are doing a campaign at the moment, and we keep asking men, like, how do we bring you in? But what would your top tips be? Obviously, you speak to men and women all the time, and you speak a lot about fertility. But how do we include the men? Not just about fertility, about hormones, about menopause, perimenopause, periods, dads with daughters. How do we encourage this conversation?
Yeah, it's a good question. And I think what I find with most things is people pay more attention when they know it affects them. So I think it's about educating that fertility is not just about eggs and ovulation, but actually it's about sperm. It's about sperm health, and that affects a man. So the things a man does affects their chance of fertility. If they are obese, if they are having hot baths, things like these affect the production of sperm. So I think highlighting sperm health to men through education, through platforms like this, through encouraging them to go to their doctor if they're having issues. So sperm health, and then also including men into the conversation about how it affects their relationship with their partner and their relationship with their daughter. How will your relationship with your partner change when they go through the perimenopause? Because it certainly will, because a woman's body is changing. Every single organ is changing, and they will feel different, and that will make them perhaps more irritable or sweat at night or not eat very much, or, and that's going to affect your relationship in general. So I think it's about, okay, how can men better support women going through menopause, going through their daughter having their first period, through women going through fertility issues. And it's just about how do we need to give them the tools. We need to teach them, look, this is what you ask, this is what you say, this is how you support them. If your girlfriend or your partner is going through their luteal phase, get them some chocolate. No, they're going to be a little bit more irritable. And it's about, it's absolutely okay to talk to them, and they shouldn't feel embarrassed, because we need to make sure they don't feel embarrassed. They're just as important as women in this conversation.
Yeah, you're absolutely right. Speaking of luteal phase, so as a doctor, obviously knowing so much and does that mean you're more in control of yourself during your personal phases?
You know what? I think you can have all the knowledge, but at the end of the day, you have to apply it to yourself. And it's always easy giving out lots of knowledge, but actually incorporating it into your day-to-day life can be quite difficult. I think when I know when I'm about to start my period, and I know that I usually feel really emotional, I'll probably cry, or I want to listen to anything. And when I start my period, I'm super tired. So I try, if I can, just give myself a little bit of grace. Make sure that I'm going to have a nap that day. Make sure that I have something that I want to snack on the day before. And I don't restrict myself. I know that I just feel a bit better if I do what my body wants me to do. And it's, it's temporary. We know that we're going to bounce back. Us women, we bounce back. So you just got to give yourself a little bit of time and space to rest and recharge during those times. But of course, it's always easier said than done, because perhaps, you're busy one day and you're like, well, I don't have time for a nap today. You sometimes have to power through.
I think, for me, I think tracking your cycle and knowing what stage you're in is so empowering, because if you're just having a bad day and everything kind of feels, by looking and thinking, oh yeah, but it is 2 days until my period, and it will get better, even though things feel like this right now, it will get better. There's just something in that. There's so much power in knowing that, don't worry, I know for a fact it's all going to change tomorrow and I'm going to feel great. And there's something me and my friends always talk about, and it's how dramatically things change when your period comes, to the point where you could be having a really terrible, or you could just feel really bad, and then your period could come and you might not even know that it definitely has, because you might not have been to the bathroom yet and checked or anything like that, but all of a sudden your mood just changes. And we talk about this a lot in my friendship group, but it's crazy, isn't it? Like how day and night it can be, from waiting for your period to come, and then your period comes and it literally feels like the sun has come out from behind the clouds. Do you hear that a lot?
Yeah, absolutely. And I usually tell my husband, like, I'm going to start my period tomorrow, and he knows what to expect.
Hang in there.
Yeah, hang in there. And you know what I'm going to be like? Don't talk to me. I just want to rest and sleep. And it's about bringing men into the conversation. It's about including them and letting them know, look, this is what's going to happen. Be prepared, but I'm going to bounce back.
Yeah, that's it. It's really about being able to give them, like you said, give them the tools to work with, and then hopefully they'll respond in the way that we want them to. Before we go, I'd love you to, speaking of tools and things like that to give people, what can people go in if somebody's not feeling right, or going back to fertility? Give us the tools to be able to go in and speak to doctors, because I hear a lot of the time that women feel like they don't know, or they feel like their doctor's not doing the right thing or doing what they want them to do. So if you're having problems with, let's say, fertility for the moment, but if you're having problems, how can you approach that with your doctor? Because as well, a lot of people are saying that the appointments are so short and they don't know what to do. So what's a little toolkit that women can have?
Yeah, so for fertility, there are some clear guidelines when you should be seeing your doctor. And it's important that you know this as a couple that are trying to get pregnant, because time is really important. And we know that referral times take a long time, so that therefore we need to be a bit on top of it so we can get you seen quickly. So if you're less than 35 and you've been trying to conceive for about a year, and that's, when I say trying, that's every 2 to 3 days for a year, and you still haven't got pregnant, we'd want to see you. If you're over 35 and you've been trying for about 6 months, every 2 to 3 days, we'd want to see you. So if it's getting to that 6 month point, you need to book an appointment. And if you've had difficulties in the past, if you've tried to get pregnant, or you've had, miscarriages, maybe had a couple, then we definitely want to see you. There is a an NHS service for recurrent miscarriage. So if you've had usually it's more than 2 or 3. But if you even have had one, you can talk to us and we can discuss things with you. But if you have had a miscarriage, please do keep trying. Doesn't mean you can't have a child. And then also if you've got underlying conditions that affect your hormones, so things like polycystic ovarian syndrome, thyroid issues, if you've had previous pelvic surgery, so any reason for you to get pregnant a little bit long, for any reason for it to be harder for you, so if any interruption with your hormones, if you've had issues with endometriosis in the past, you've got irregular periods, these are sort of things that we'd want to help you with. So get in contact with your doctor, and even if you haven't started to get pregnant yet but you're worried about it because you've got something underlying, then we can perhaps screen for you and do some scans, perhaps a blood test sooner, to help prepare you for when you get pregnant.
Is there anything that women should never ignore? Is there any symptom that you would say, come and see me today?
I think that there are a few that, if I'm being in the whole of gynecology, there's quite a few red flags depending on your age and if you're perimenopausal or going through fertility issues. But if we keep it broad and general, I'd say if you're having painful periods that are very painful and stopping you from doing your everyday life, if you're having painful sex and any bleeding during sex, we absolutely need to see you. And if your periods are irregular for more than 3 months, but previously were regular, so this is a new change and you've tracked it over 3 months and haven't been regular, we want to see you. And if you've noticed any weird discharge that's different for you, so if that's something that's smelly or green or a different colour, then we'd want to do some screening tests for any sexually transmitted infections. So they're sort of more broad topics. But if you're just not feeling right, if something feels off for you, whether it's your time of your period, your discharge, sex feels painful, you've got a lot of tummy pain, all of those things, you need to see your doctor.
That's great. Thank you so much, Dr. Ravina. It's been so lovely to have you here today, but also so helpful for so many women. And I'm so pleased that, you're on the same bandwagon as us to get more men into the conversation. And thank you so much for all of your insight.
Oh, thank you. It's been an absolute pleasure talking to you and such informative questions. And I really hope it's helpful for all your listeners. And if anyone wants to ask me any questions, feel free to reach out to me on Instagram or TikTok. And it's at Dr.Ravina.
Thank you.
Thank you.
Yay! That was great. Thank you so much.
Oh.
Honestly, I could go on. If you enjoyed this episode today, don't forget to like and subscribe to the House of Hormones podcast. Your support really does help us reach more people and spread the word about women's health. If you want to stay connected, follow us on our social media. And here's something really important. We're on a mission to secure more funding for women's health initiatives. Sign our government petition today and help us amplify our voices for better healthcare resources and support. Together, we can make a difference. Thank you for being part of our journey. We can't wait to see you in the next episode.